What are the challenges in getting all of your staff on the same page?
Well, like we had kind of talked about, I mean, number one, the way that healthcare works now, at least, in our facility, is it's pretty rare that you have a doctor in your facility that's just designated to your facility. They are running around between different facilities. You might have a doctor that's, caring for the patients in your facility, but they're also caring for the patients in 4 or 5 other facilities in the valley.
Yeah, the entire
right?
region, right?
Yeah. So, I mean, it's next to impossible in my world to get a doctor into that care conference unless you time it just right when they're going to be rounding on your patient, amidst the 100 other patients that they have around the valley, and that they can dedicate, a little bit of time to talk with the families. But, the person that's driving the ship isn't always there and available, and that's the person that everybody wants to hear from. Right. And so, number one, I mean, you have that, but then number two, communicating, okay, once we actually meet with the family and the lead people on the care team about the direction that we're going to go, communicating that down to the rest of your team. Now, if just in my facility, and I've got a small facility, we have a 38-bed facility, communicating that down to your team where you have, 20 nurses and 40 CNAs, and making sure all of them get that information on this one patient, and their schedules are so different too, is a huge challenge. And all of the time, 100% of the time, that's a big number.
Yeah.
There's always something that's lost, and there's always something we have to go back and revisit. There's always apologies being made because we've had this care conference and somebody, didn't get that message passed down to them, and that's a huge frustration for me. Because, we'd like everyone to have all that information just at their fingertips and ready to go and be able to hear from the doctor and have the families be satisfied and know what's going on and have the patient know what's going on and have our team know what's going on, Yeah. But so much of it actually gets lost because of the world that we live in. It's hard to get everybody in, the same page.
It's really difficult if there's not a central place to memorialize all of that content, right?
Right. Yeah.
So talk about how this challenge of getting everybody on the same page is affecting your staff.
Well, again, that's just contributing to the burnout, right? Because, nobody is coming to work and wants to do a bad job, but if they don't have all the information that they're, what they're supposed to do, then inevitably, they're going to be making a mistake or not be doing everything right. And then, people that don't quite understand how the healthcare system works get very upset, and you're coming in and you have the best intention to do a great job, but you're getting in trouble maybe by a family member or a patient, could be another member of our healthcare team. I usually am trying to be compassionate. I don't believe in coming down hard on people for that, because we're all trying to do the best that we can, but it does contribute to burnout for sure, because they want to do a good job and they don't feel like they are.
I think that's the biggest challenge, when people are checking the boxes and saying, I'm living my life by the regulations, and I'm living my life by the heart and the intent of why I got into this business, and then the result, the reverberance, the feedback that's coming back to them from family members that don't understand, that can lead to burnout pretty quickly.
There's so much of that negative feedback, that people really do just like, okay, I'm not gonna do this anymore. In fact, a huge part of my job is really just telling people, hey, you're doing a great job. We appreciate you.
Reinforce the positive.
Just really reinforcing the positive, because there's so much, of this negative out there of, why aren't you doing this? Why aren't you doing that? And it's difficult. It's difficult. Yeah.